All right. Well, I'd like to welcome everyone back to the brain injury discussion. Today, we're going to talk about medical imaging and what implications it has for the skull and the brain. Like always, our sources will be in the description below. We do appreciate comments and feedback. We always love hearing that. And feel free to give this video a like, as well as feel free to subscribe to the channel if you're really enjoying this kind of content. We try to keep it informational and educational and practical, and we try to keep it timely as well, under 15 minutes. So, with that being said, we will get into what is medical imaging and why it pertains to the brain. So let's start back about 130 years, and we're talking about the rudimentary X-ray. So again, this was made by Mr. Roentgen in 1895 in Germany. So this technology has been around 130 years, and it's still being used today. So obviously, this is a very important and very useful, pragmatic piece of equipment that doctors will utilize for diagnostic testing. But the main point I want you to take away from this slide about regular X-rays is that it's used to identify hard structures like the skull, maybe other types of bony structures within the body. Maybe they're looking at the C-spine, and all of that is really crucial to body function. You do need a skull, you do need a C-spine, but this is looking for those bones. We're looking for hard structures. And again, this is a commonly used medical diagnostic tool. And this was really a big game changer in medicine, um, because now you're able to look inside the human body at those hard structures like bones and see other kind of structures. Especially when the Great War broke out, you could find bullets that were really deep down into the soft tissues. And now this is still used to same purposes, but maybe even more. And so this has been very useful. And I can't find where I found it, but I heard a story that this was invented to sell to shoe salesmen so they could make sure that the shoes fit properly. But basically put, that would work, but it's come a long way for medical imaging. So again, we're looking at bone, a lot of hard and maybe some smaller softer tissues, maybe cartilage, but it's minimally invasive. And so it is a probably a first go-to when you come to imaging, especially when you're looking for broken bones. So um, with that being said, that is X-rays in a nutshell. Think about what you would use this for. Obviously, the skull is a big one, and same with the C-spine. So when we move forward about 70 years, we get what's called computed tomography or CT scans. Some people call it CAT scans. And like in the name, it's done by computer and it is tomography. And we can see that this machine here is a CT scan. It's very tight and compact. Um, Again, it's minimally invasive, but it is a tight space. So if you're claustrophobic, this probably is not your friend. But it was invented in 1967, and it really is great for examining soft tissue structures. And it gives you that internal view of the body. So if you're looking at the anatomy from a two-dimensional way, but you're also looking what's inside. For example, the skull. You're looking at what's inside the body. And as we can see with this image down here, that we're able to see a healthy individual skull. We're able to see in a 2D format, in a just kind of like a picture. You were able to just slide that in there. You're able to see every view and every angle. And this is actually very useful because you're able to see those soft tissue structures that you wouldn't be able to see with a traditional X-ray. You're seeing those soft tissues. You can actually see if there's any tumors, any growths in the brain. But again, this thing, every imaging has its limitations, and CT produces that two-dimensional image. So a two-dimensional image is probably a really good thing for a lot of diagnosis, but it might not be the best thing, which again, for 1967, this was state of the art. And that's actually, in the grand scheme of things, very recent. So, with that being said, that is the CT scan in a nutshell. It's 2D imaging, it's computerized, and it's very minimally invasive, although tight space, but it's for those soft tissue structures. So, let's move on into MRIs. So the MRI is magnetic resonance imaging. So it uses a series of magnets. It was developed in the 1980s, so another 20 years post the CT scan. Um, but it uses magnetic fields and magnets. Um, keep that in mind. I'm going to make a point here later, but it looks for the radio waves of body hydrogen. Hydrogen's in a lot of the cells. And so really it's bouncing it off of hydrogen. And that's how you're able to come up with images like this on the right. Uses computers and it creates that image based on the input and the resonance. And sometimes you might use contrast, especially this is given either orally or by IV, and it could give you a different kind of image, different kind of diagnostic tool. But when we're talking about MRIs, we do have to make the cautionary point that you don't want anything magnetic when you're dealing with a magnetic resonance imaging system. So if someone has a pacemaker, they have metal implants or, anything with metal in it, maybe you're wearing a watch, maybe you have a medical bracelet, maybe you have some pins and stuff in your body from a fracture. Um, if you are a brain injury case manager, you might want to know that because in the case a doctor who might be seeing the patient for the first time does not know about that history, um, maybe that would be an important point because you don't want someone who has those magnetic parts in their body to go into an MRI because that would be dangerous. That would be bad. And so, as a case manager, it's important for me to think, okay, can this person go into an MRI? Can this person go in and be around magnets? And the same thing applies with the other imaging styles because they have their own precautions too. But with MRIs, that's pretty important. So, again, just keep that in mind, and especially if you're a provider or maybe you're a patient. Um, keep maybe ask them, hey, do you have any metal implants? Do you have a pacemaker before you go into this? Because that could be a bad thing. So, but moving on, there's another layer of medical imaging, and it's even newer, and that is what is called SPECT scanning. So, it is single photon emission computerized tomography. So think about it like a CT scan, but it's married to nuclear medicine. So nuclear medicine is a whole nother branch of imaging in and of itself, but it is computer tomography with the single photon emission. So um, it's used for diagnostics, and it creates a very 3D computer image of what you're looking at. And in this case, it is the brain. And so it uses what's called radioactive tracers. So it's an injection or it's an orally taken substance that follows and goes through the body and shows the activity in the body. And so these tracers provide very important information about the organ and also the level of its function. And so what we see here on the image to the right, we see a SPECT scan of two different brains. The brain on the left is a healthy looking brain. It looks complete. It is there, and you can see that there's activity all around. If you ever watch a TED talk about what SPECT scanning does, it looks for that imaging, it looks for that activity. And so that's a healthy looking brain. But to the right of that healthy looking brain, we see a brain that is affected with two strokes. And this is how I picture Woodrow Wilson's brain would have looked like after his second stroke. And we see that there are major gaps and holes in there. And that's not something that, again, the brain matter tissue is probably still there. Um, but as we can see, there's no activity there. And so that can be kind of problematic. That would be an indication as to why SPECT scanning would be useful, is if you're looking for the activity of the organ, not just is it there. And SPECT scanning is still fairly new, and it combines that nuclear medicine and SPECT scanning. It's can be more invasive than your traditional X-rays and your traditional imaging techniques, but it does give you a different kind of image. And so, what does this leave me as the brain injury case manager to conclude? Well, I know that medical imaging has gone a long way. It's advanced a very far way from just rudimentary X-rays where we can see the hard structures, and now we can see internal soft 2D pictures of things with CTs, and then we can look at 3D images with MRI, and then we can look at 3D images about activity with SPECT scans. Also, MRIs, we have multiple kinds now that, okay, maybe they have an open MRI, which are, for those who have claustrophobia or uncomfortable in those spaces, that can be used as an alternative. So keep that in mind as a brain injury case manager. I might have to advocate for that. Each imaging has its own type of image. So again, if sometimes X-ray is the best choice, sometimes it's the other forms of radiation imaging, and each one produces something different and might answer different kinds of questions. And because it produces something different, it's used for different purposes. So again, that hard skull, I want to use an X-ray for, or might advocate for someone to use an X-ray. If it's a soft tissue, maybe it's a CT scan, maybe it's an MRI. Maybe it's talking about brain activity. Maybe that would be a SPECT scan instead. And so each imaging has a unique and different purpose, and it covers a wide different range of diagnoses, but it's good to know why you would use this imaging device over this one. And again, knowing why. Knowledge is power, especially in the doctor's office. Know why and what they're looking for, because that might change what kind of imaging you need, because it might not be good enough just for an MRI. Maybe you need a SPECT scan, or maybe if it's a hard, maybe you suspect a fracture, maybe you do need an X-ray. Maybe you're looking to check on, make sure that this thing is in place. Maybe the X-ray is the best, maybe the CT is the best. If it's magnetic, MRI is not the best, but each one has its own purposes, and knowing which one does which does help in not only medical advocacy, but it also helps in better decision making. But with that being said, that's what I'm taking away from this as the brain injury case manager. My sources will be on this next slide here. Let me pull that up. Feel free to look up these sources. I always encourage that. If you found this information useful or maybe informative, feel free to give us a like. We like those thumbs ups. Feel free to subscribe if you like seeing this kind of content, or maybe you have a suggestion for a video or a topic. Feel free to put it in the description down below. We definitely enjoy hearing your feedback. But with that being said, I hope everyone has a wonderful day. Don't forget to protect your brains out there, and maybe take an image and maybe consider some imaging. So have a good one, everyone.